So now, Dr. Naresh, you're a vascular surgeon. Now, vascular surgeons mean you take care of, my understanding here, you take care of any blood vessel outside the heart, right? And the
No,
brain.
the brain, no. We take care of the arteries in the neck, which supply the brain, the
Ah,
carotid arteries. The
okay.
ones in the brain are taken care of by the neurosurgeons.
See. So anything below the neck,
Yeah.
not the heart, everything is yours,
Yes, everything, all the
the
vessels are
whole
out.
body. So tell us, as a vascular surgeon, what is your role in treating a diabetic foot? Is it blood supply and all that?
A lot of times, one of the major problems with diabetic foot is that the lack of blood supply. Because diabetes itself causes changes in the blood vessel, that they get narrowed blood vessel or get it blocked. So if it's blocked, so then it comes to a vascular surgeon. And so one of the things that a doctor, when a person goes and sees a doctor with a diabetic foot, the first thing they feel are pulses. Traditionally, everybody will say the pulse is felt in the wrist, and you just feel a pulse there. As you can, there are lots of other places you can feel the pulse, including the neck and the leg, so the thigh, behind the knee, and in the foot itself. So doctors will then feel for the pulse, and if don't feel the pulse, if there's no pulse, that means there's lack of blood supply, and that's the least they can do. For then they will refer to a vascular surgeon. A vascular surgeon will then assess the foot itself, and then will look at the vascularity of it. Because if you don't uh, establish good blood supply, nothing will heal, and your wound will just progress, and it will become a problem. So that's why the role of a vascular surgeon is to re-establish blood supply. And we re-establish blood supply by various means, anything from medication to angiogram, angioplasty, stenting to bypasses. So the whole thing is done by vascular surgeons.
So in a way, if you have a diabetic foot and you are seeing a Chinese sincere and you're not taking care of the blood vessel problem with a vascular surgeon, you are not going to heal that foot, right?
It will never heal. It will never heal. I mean, that's one of the problems faced by patients in this country, because sometimes they get this infection in the foot, and nobody feels the pulse. Nobody actually knows whether there's enough blood supply. So you just pump them with antibiotics. They get, so they start off with one small little injury to the toe, so then it gets a wound debridement. It gets you cut off a little bit. Then it progresses. Toe comes off. First toe comes off. Second toe comes off. Third toe comes off. Front of the foot comes off. Then it just progresses from part to part. Eventually, then the whole leg comes off, because nobody addressed the problem of the lack of blood supply. Nobody looked at it.
So if anybody who has a parent, listen to this. Those who guys you're listening, please share this out to friends who has diabetic foot or are diabetic. If you have any parents who has this problem, please solve their blood supply problem with a vascular surgeon first, right?
Yeah, I think you should see you should actually get somebody to look at the vascularity. That means if a person is seeing the regular doctor, if you see the diabetic doctor, the diabetic doctor will feel the pulse and look at it. And then they will see a vascular surgeon to actually to assess the leg itself. If a person is seeing a GP, the GP should feel for the pulse and then refer accordingly.